Tired of unpredictable cycles? Before you turn to medications, try these doctor-approved home remedies for irregular periods that have scientific backing. From a simple daily spice to stress-busting techniques, today we're revealing natural ways to help regulate your menstrual cycle and explaining when it's time to see a professional. Why do periods become irregular? There are many reasons why your cycle might not be running like clockwork. One of the most common issues is menorrhagia, which is the medical term for very heavy or long-lasting periods. You might be dealing with menorrhagia if your period lasts more than 7 days, or you have to change your pad or tampon every hour because of heavy bleeding. What can cause this? Here are some possible causes of irregular or heavy periods. Medications. Certain drugs like hormone treatments or even anti-inflammatory meds can throw off your cycle. Some types of birth control like IUDs may also lead to heavier bleeding, especially in the first few months. Hormonal imbalances. Your body relies on a balance between estrogen and progesterone to manage the thickness of your uterus lining. Too much of one and not enough of the other can lead to extra heavy periods. This imbalance is especially common during puberty or as menopause approaches. Medical conditions. Irregular periods can also be linked to health issues such as endometriosis, where tissue similar to the uterine lining grows outside the uterus, pelvic inflammatory disease (PID), blood clotting disorders, or non-cancerous growths like fibroids or more rarely certain cancers. Can you do anything about it? Yes, definitely. The right treatment depends on what's causing the irregularity. But in many cases, there are simple home remedies and lifestyle changes that can help get your cycle back on track. Backed by science. We'll explore 8 effective remedies in the next section, so stay tuned if you're looking for natural, practical ways to support a healthy menstrual cycle. Natural ways to regulate your periods. If your menstrual cycle feels a bit all over the place, don't worry, there are some simple, natural things you can do at home to help bring it back into balance. Let's start with 2 science-backed remedies that really make a difference. 1. Try yoga, gentle movement, big impact. Yoga isn't just about flexibility, it's also a great tool for balancing hormones and reducing period-related discomfort. In one study, women who practiced yoga for 12 weeks saw improvements in things like cramps, breast tenderness, swelling, overall body pain. Another study showed that doing just 35 to 40 minutes of yoga 5 days a week over 6 months actually helped lower hormone levels that are often linked to irregular periods. Yoga can also help ease emotional symptoms like anxiety or low mood that often come with your cycle, especially if you have primary dysmenorrhea, which causes intense pain before and during your period. 2. Keep a healthy weight, find your balance. Your weight can have a surprisingly big impact on your menstrual cycle. If you're carrying extra weight, it might lead to heavier and more irregular periods. That's because fat cells can mess with your hormones, especially estrogen and insulin. On the flip side, being underweight or losing weight too quickly can also disrupt your cycle, or stop it altogether. The goal isn't about achieving a perfect body, it's about finding a healthy weight for you that supports hormone balance and regular cycles. Real-life example, think of your body like a car. If there's too much or too little fuel, it won't run smoothly. Your hormones work the same way, they need balance to keep your cycle on track. What to do? If you're unsure what a healthy weight looks like for your body, talk to your doctor or a nutritionist. They can help you make a plan that's safe, sustainable, and tailored to your needs. 3. Get moving. Regular exercise helps more than just fitness. Exercise is like a secret weapon when it comes to balancing your menstrual cycle. Not only does it help you maintain a healthy weight, which as we've seen can support regular periods, but it's also part of the recommended treatment for conditions like polycystic ovary syndrome, PCOS, a common cause of irregular cycles. Even if you don't have PCOS, exercise has been shown to help with painful periods, aka primary dysmenorrhea. One study from 2021 found that women who exercised regularly experienced less intense and shorter-lasting period pain. What kind of exercise helps? You don't need to become a marathon runner. Just 30 minutes of moderate activity, like brisk walking, dancing, swimming, or cycling, most days of the week can work wonders. Real-life tip. If you're someone who doesn't love gyms, try turning on your favorite playlist and dancing around your room. It still counts and it lifts your mood too. 4. Ginger, a spicy little helper. Ginger has been used for centuries in traditional medicine, and while it may not directly fix an irregular cycle, it can be a huge help for menstrual symptoms. Here's what the science says. A study in 2014 found that ginger supplements helped reduce heavy bleeding during menstruation. Taking 750 to 2000 milligrams of ginger powder during the first few days of your period can help ease cramps and pain. Ginger may also help with PMS symptoms like mood swings and physical discomfort. In one study, women who took ginger for the week before their period felt a noticeable difference in their mood and energy. Example: think of ginger like that friend who doesn't fix the problem but shows up with snacks, hugs, and a heating pad when you're having a rough day. It makes the whole experience more manageable. How to use it? You can take ginger capsules, stir powdered ginger into hot tea, or even try grating fresh ginger into soup or smoothies. 5. Sprinkle in some cinnamon. Cinnamon isn't just for lattes and holiday cookies. It may actually help with menstrual health too. Some small studies have shown that cinnamon can help regulate menstrual cycles, especially in people with PCOS. Reduce period pain and heavy bleeding. Ease nausea and vomiting caused by menstrual cramps. In fact, cinnamon is often considered a safe and natural remedy for young women dealing with primary dysmenorrhea. That's the term for painful periods without an underlying medical issue. How to use it? Add a teaspoon of cinnamon to your oatmeal, tea, smoothies, or even sprinkle it over toast with a bit of honey. It's a simple way to support your cycle, and it tastes great too. Think of it this way: cinnamon is like the quiet MVP of the spice rack, humble but with powerful health perks. 6. Don't forget your vitamins. Getting the right nutrients can do more than just boost your energy. It can help regulate your cycle and ease PMS symptoms. Vitamin D. Studies have found a link between low vitamin D levels and irregular periods. For people with PCOS, vitamin D supplements may help get cycles back on track. You can get vitamin D through sunlight, fortified foods, like milk or cereal, or supplements. B vitamins. Vitamin B6 may reduce symptoms of PMS and depression before your period. One study showed that women who took 40 milligrams of B6 and 500 milligrams of calcium daily had less severe PMS. Vitamin B-rich foods include leafy greens, eggs, fish, poultry, and whole grains. Real-life tip: if your period brings mood swings or fatigue, a daily vitamin routine might help smooth things out. Think of it as giving your body the tools it needs to stay balanced. Safety note: always follow the instructions on supplement labels, and talk to your doctor before starting something new, especially if you're already taking medication or managing a health condition. 7. Sip some apple cider vinegar, ACV. Apple cider vinegar, ACV, has been a go-to-home remedy for everything from digestion to skin care, and now some early research suggests it might help with menstrual health too. In a small 2013 study, women with PCOS who drank about 15 milliliters, just 1 tablespoon, of ACV per day saw an improvement in ovulation and menstrual regularity. That's promising, but keep in mind the study only included 7 participants, so more research is definitely needed. How to take it? ACV has a strong, sour taste that not everyone loves. Try mixing it with a glass of warm water and a spoonful of honey to make it easier to drink. You can also splash it into salad dressings or smoothies for a gentler approach. Think of it like this: ACV might not be a miracle cure, but it's a small, simple habit that could support your cycle, especially if PCOS is part of the picture. Pro tip: because it's acidic, don't drink it straight. Always dilute it to protect your teeth and stomach lining. Pineapple, sweet and maybe helpful. Pineapple is often talked about as a natural remedy for period problems, and here's why. It contains bromelain, an enzyme that may help soften the uterine lining and reduce inflammation. While there's no solid scientific proof yet that pineapple can regulate your cycle or stop cramps, bromelain has been shown to have mild pain-relieving and anti-inflammatory effects, so it might still be worth trying. How to enjoy it? Eat it fresh, blend it into a smoothie, or toss it into salads for a tropical twist. Bonus: it's packed with vitamin C too. Fun thought: even if pineapple doesn't fix your cycle, it can still brighten your mood, boost your vitamin intake, and satisfy your sweet tooth. No harm in that. Final thoughts: bringing balance to your menstrual cycle naturally takes patience and consistency, but these home remedies, backed by studies or traditional use, can make a real difference over time. From yoga and vitamins to cinnamon and pineapple, the goal is to support your body, not stress it. And remember, if your periods are regularly irregular or causing major discomfort, it's always a good idea to check in with your doctor to rule out any underlying issues. Remember, while these home remedies for irregular periods help many, they're not substitutes for medical care if you have underlying conditions. Track your cycles for 3 months when trying these methods. Got questions about your specific situation? That's what doctors are for.